I threw 5 pills in the trash and no. It was an outburst of drama, it was a conscious decision. And I tell you from respect, after 60, there are medicines, normal that in certain people can increase the risk of heart attack or push the body towards a crisis without anyone. I saw it coming. I am Dr. Javier Serrano. And before you get scared, I'll leave it to you clear from the beginning. Don't suspend anything on your own. This video is not for you to throw away your medications today. It is so that learn to ask the right question, because the problem is not always the illness. Many times it is the combination, dose, time, or fact that no one checked your medicine cabinet in years. Look, I have experienced this in consultation and also with family. And when something touches yours, stop being theory. It becomes a conversation. Urgent. Today we are going to review 5 types of pills used every day. For pain, for sleep, for nerves, for allergies, and even some for pressure. And I'm going to explain to you why that after 60 they can be a trap. And I will do it with a very map. Simple. I tell you what it is, why it is used. Therefore, what is the hidden risk in older, what signs you should watch for, and what safer alternative you can discuss with your doctor without panic, with intelligence. Because the goal is not to live with fear, the goal is to live with calm and with control. Mini test. Fast. Is there someone in your house who drinks a lifelong pill that no one have you reviewed it in years? Or someone who mix sleeping pills with something for pain? If you answered yes, stay, because the first on the list. It is in almost every house and many people don't know what it does to them. Pressure, kidney and heart. Before get on the list, let me give you an idea that will order your mind. At 40, the body compensates. At 60 and 70, body is still strong, but changes the way it processes chemicals. The liver metabolizes more slowly, the kidney filters with less margin, the brain becomes more sensitive, and the heart stresses more with sudden changes in pressure, fluids, or rhythm. So, a pill that previously only used to make you sleepy, now it can cause dizziness, and dizziness can turn into a fall. And a fall in an older adult is not a bang. It could be a hip fracture, surgery, immobility, infections, clots, delirium, and a waterfall that ends up hitting the heart. Let me complete that sentence, because there is the center of the matter. A fall in a older adult is not an accident. A fall can be a fracture, and a fracture can be surgery, and a surgery can bring immobility, and the immobility brings muscle loss, loss of balance, risk of clots, infections, and confusion. All of this takes work to the heart. Therefore, when we talk about pills, dangerous, many times the damage is not direct, it is because of the chain that trigger, and so that it does not stay in abstract. Think about the typical routine of many homes. Pressure pill. In the morning, a gastric protector. If anything, an anti-inflammatory when back hurts, something to sleep. When insomnia comes, a syrup. Night when there is cough, a antihistamine when there is allergy, and soon you have 5 or 6 substances that step on each other. Add something to that, which almost no one counts as medicine. Natural supplements. Some lower blood pressure, others lose weight. Blood, others disturb sleep. Don't you I'm saying that what is natural is bad. I'm telling you that it also counts. And in people over 60 everything counts. That's why today I ask you a very specific thing. Don't listen to this video as it leaves your medicines. Listen to it as it checks your system. Because if you correct the system, you can live more stable, sleep better and walk more safely. And in the end, from the video I'm going to leave you a question that you should use in each query. I repeat it until it sticks. Doctor, what's the worst that could happen with this medicine on someone my age? That single phrase changes the way they explain and take care of you. I call that the medicine cabinet trap. It is not that all medicines are bad, is that without review they become in a disordered system. And a system messy is fertile ground for a big scare. Let me give you a picture so that you understand it without technicalities. Your body is like a house with pipes and electricity. The medications are such as keys, switches, and valves. A valve may be useful if you are in the right place, but if someone starts to move valves without seeing the plan complete, a small adjustment may trigger a big problem in another part. That's exactly what happens when an elderly person adds pills over another without review. And this review is not to blame a doctor. Many times the problem is that the person consulted several specialists in different years. Each one saw his part and no one put it together. Puzzle. Or this also happens. They prescribed something for you for a temporary symptom, and like no one else, he retired. He stayed in your life as if was permanent. Therefore, before let's get to the fifth pill, I want that you have a clear goal in your head. The goal is not to run out of medications. The goal is to keep what you need, with the correct dose, with the lowest possible risk, and with a plan. Follow up. Now yes, first category. And listen to this so that you don't normalize pills for pain and inflammation. You take them by the knee, the back, the hip, the shoulder. They are free for sale, and that is why people think if they are sold without a prescription, no, they can be dangerous. I'm referring to anti-inflammatories, steroids, the famous AINES, ibuprofen, naproxen, diclofenac, ketorolac, and several more. They are useful, yes. They can reduce the pain, lower inflammation, allow you to walk, but after 60 in certain people can push the body towards an event, cardiovascular, and most do not know it. Because these medications not only act on your knee, they act on vessels, kidney, and pressure. In some people they make the body retain sodium and water. That translates into more volume circulating. And for him, heart, more volume is more work. Yeah. You already have hypertension or your heart. You are already tired. That extra load can be the push. Additionally, NSAIDs may reduce the blood flow within the kidney. And here, I want you to remember this. Heart and kidney are partners. When the kidney stresses, the pressure rises, the body retains fluid, hormones are activated. Stress and the vessels become inflamed. This environment increases the risk of complications. Now there is a detail that many people ignore. Many people take NSAIDs and at the same time they take medications for pressure. And here the AINES can sabotage treatment. They raise the pressure and make your pill for hypertension appear weak. Then someone ends up with more doses and more drugs when the trigger was frequent anti-inflammatory. They can also increase the risk of gastric bleeding, especially if combined with aspirin or anticoagulants. And bleeding is not only a problem of the stomach. In an older person it can cause anemia, weakness, palpitations, and decompensation. The heart works worse when the blood it doesn't carry enough oxygen. I give you a realistic example. One is 68, pain. Knee. Start with ibuprofen alone. A few days it works. Then it. Repeat every week, then take it almost. Diary. 2 months later he arrives with swollen ankles, higher pressure and shortness of breath when climbing stairs. He thinks it's age, his family thinks that it is tired, and no one thinks about it. Ibuprofen. And here's what's scary. Sometimes there is no strong signal. It doesn't hurt. It doesn't warn. It's silent. Just a little more pressure, a little more liquid, a little more stress, until the heart complains. What signs should you turn on focus? Higher pressure than before, swollen ankles at the end of the day, less urine or very urine, concentrated, shortness of breath when walking, distances that you previously tolerated, acidity, strong or black SEs, not to enter in panic, but to act in time. Does it mean you can never take a anti-inflammatory? Does not mean that. After 60 it should not be automatic, nor chronic without surveillance. And if you have a history of heart attack, heart failure, difficult pressure to control, kidney disease, or taking diuretics, care must be double. What do you do instead? First, change the idea. Chronic pain does not manage itself with pills, it is managed with strategy. For mild to moderate pain, often paracetamol may be another option. Friendly with the heart, always. Respecting doses and taking care of the liver. Another powerful alternative is local treatments, gels or patches. Topical, because they act where it hurts with less systemic impact. And there is also simple tools that reduce pain without pay the heart the bill. Heat for the afternoon, ice after activity, gentle range exercises and a routine. Simple force to stabilize knee or hip and thus reduce the need for anti-inflammatories. Ruler. Simple for this first one. If you have more 60 and you take ibuprofen, naproxen or diclofenac frequently, do not normalize. Talk to your doctor. Check pressure. Check kidney. Look for alternatives. Your heart does not negotiate with just one tablet. Let's go to the second category. And here, many tell me, "Doctor, but this pill saves my night." I understand, but for people over 60 the cost hidden can be huge. I talk about the benzeniazepines, alprazolam, lorazepam, diazepam, clonazepam, and others. They are used for anxiety, nerves, insomnia, spasms. They calm down quickly, and that quickly engages because when one suffers, wants immediate relief. The problem is that in older adults these pills, they affect balance, reflexes, and memory. And the biggest risk is often not. It is a direct heart attack, it is the fall. And the fall may be the quickest way towards a shorter life. Imagine this. It's 3 in the morning. You wake up wanting to go to the bathroom. You incorporate. The body is still under the effect of that half pill. Your reflexes are slow, your pressure. It changes when you stand up. You take a step and the floor moves, a fall, a blow. head or hip fracture. Then comes hospital, immobility, infections, clots, delirium. And there heart suffers, and here is another trap. When someone takes them for years, the body gets used to it. You need more to feel the same effect. You increase the dose and the risk increases. And if you try to leave her, anxiety rebound appears and insomnia. Therefore, this is always review with a plan, calmly and with supervision. Plus, these medications add up. Body takes longer to eliminate them. What was gone at 40 was gone at 70. Is left over. That is why many people feel off during the day with confusion, brain fog, and they scare thinking of dementia when in reality is pharmacology. There is another delicate point. In some people, they can worsen night breathing. If you snore loudly or have sleep apnea, sleep and you don't know it, a sedative can worsen breathing pauses. Less nighttime oxygen means more cardiovascular stress, and that can increase risk of events. And be careful with the combinations. Benzodiazepine plus alcohol, even a drink benzodiazepine plus sedative antihistamine. Benzodiazepine, more strong analgesic. That mixture is how to put extra weight on a brain now. Sensible. In older people the margin is minimal. So what alternative is there? First, actual sleep hygiene, not the nice phrase, physiology. Low light. An hour before, screens out, dinner. Lighter, more stable schedule and a short relaxation ritual. Second, treat the cause. Sometimes it is poorly controlled pain, sometimes it is chronic anxiety, sometimes it is depression, sometimes it's sleep apnea, sometimes it's reflux or need to go to the bathroom. Cover with an uninvestigated venodiazepine is how to turn off an alarm by removing the sac. If it is really needed, it is used the shortest time possible with a plan, exit and with supervision. And here I repeat, do not stop suddenly if you already take it. Diary. It should be adjusted with your doctor. Simple rule, after 60. Benzodiazepines should not be for always. If someone takes them all nights, it's time to review it with calm for protection. Third category, old medicines that are still used for nerve pain, migraines, or even to sleep. I mean antidepressants. Tricyclics, especially amitriptyline. In low doses it can help neuropathy, chronic pain, migraines. But in people over 60 it can cause dizziness when standing up, drowsiness, and in some people affect the rhythm of heart. Not in all, but the risk exists, especially if there is a history, cardiac, or if combined with other drugs, and it has effects. Anticholinergics, dry mouth, constipation, vision, blurred, urinary retention, confusion. When you add that with other medications, the brain becomes cloudy. The person thinks, I'm getting old very quickly. And sometimes it's the cocktail. There is a simple sign to suspect this problem. Dizziness right when you get out of bed, or the chair that improves when you sit down. This suggests a drop in postural pressure. Doesn't mean it's always the pill, but it's a powerful track. I give a typical case. Carmen, 73, with diabetes, nerve pain in the feet. They give my triptyline at night. He sleeps, yes, but he starts to get up. Dizzy one day, he faints when he gets up. Fast. Luckily, it doesn't fracture, but the scare remains. And no one connected the dizziness with the pill until the complete system. What alternatives are there? Depending on the case, there are options with different profiles in addition to dose adjustments. There are also non-pharmacological measures. Control glucose, improve sleep, gentle physical activity, physiotherapy, and comprehensive pain management. The goal: it is not suffering, it is treating it in a way intelligent. Simple rule: if you are over 60 and you take amitriptyline, check with your doctor if it is still the best option, especially if there are palpitations, confusion, severe constipation, or dizziness. Fourth category: pills for allergies, colds, and many times to sleep. I'm talking about top-notch antihistamines, generations such as diphenhydramine and others. Similar. They make me sleepy, that's why people say, I take one of these and I fall. But that's not. It is restful sleep, it is sedation. And in older adults that sedation can be dangerous. They can cause confusion, worsen memory, cause retention, urinary constipation, and vision blurred. And again the pattern appears. You get up at night to the bathroom, you are sedated, you get dizzy, you fall. I have seen older men end up in the emergency room due to strong urinary retention related to these pills. Pain, stress, high blood pressure due to the crisis, and heart suffering from a problem that it seemed like just an allergy. Furthermore, many people do not know that these substances are hidden in night products for cold, syrups, PM combinations. The person thinks they took something soft, but he actually took a sedative, anticholinergic. To do? For allergies there are antihistamines, second generation, that usually cause less drowsiness and fewer side effects. Brain. And if the goal was to sleep, we return to the essentials. Routine, light, schedules, and treat the cause of insomnia. Do not cover it with a pill. A cold. Simple rule: if you have more of 60, avoid converting a pill. Old allergy in your sleeping pill. You balance and your brain will help you. Charge. Fifth and last category. It is a medicine for pressure, and controlling pressure is vital. The point: it's how I talk about certain blockers, short-acting calcium channels, especially nifedipine. Immediate release, sometimes used as low-pressure fast. In people over 60, lowering the pressure too quickly can cause dizziness, fainting, and reduce flow to the heart. Think like this: if high blood pressure is a gate with a lot of load, you don't want dynamite it, you want to lower it gradually. When the body receives a change, abrupt, may react with tachycardia, dizziness, and in people with stiff vessels or coronary heart disease that it may be dangerous. After 60, glasses are usually more rigid. This rigidity makes the sudden changes feel more. When the pressure drops suddenly, the brain can receive less flow per second. This causes dizziness, blurred vision, even fainting. And a faint is a fall. Again, the chain. That is why today they are preferred. More stable regimens with medications. Long-acting when appropriate. The heart loves stability, vessels. Older too. Simple rule: if you or someone in your house uses ifipino action, short to lower the pressure quickly, that deserves a conversation with the doctor. There are safer and more sustainable options. Now I want you to see the pattern of these 5 categories. It is not demonizing medicines, it is understanding. Context. After 60, the margin of error is minor. What was tolerable before is now can become dangerous. Accumulation, interaction, or sensitivity. Now you may be wondering, Doctor, so what do I do today? I say in a simple plan. Open tonight your medicine cabinet, gather all the pills, including those in the bag in the nightstand, in the kitchen. Sometimes the duplication is hidden. Different brands with the same ingredients. A nighttime product with a sedative inside. An anti-inflammatory that you take without counting it as medicine. Then in the next consultation, do not bring only yourself. Memory. Take the list, or better take the jars, and ask what each is for. Medication if still necessary. Today, and what is the main risk in someone your age? That conversation changes lives, and if you doctor tells you it's still the same, it's fine. Sometimes it is best to continue, but now you continue with conscience, with vigilance, not automatically. And here comes the part most important of the video. Don't throw impulse pills. Write all the pills that are taken at home, including over-the-counter vitamins and natural products, and take them to a review with your doctor or a pharmacist. This is called a medication review and can save you from a waterfall. And if only. Do you remember a phrase that is this? Doctor, this medicine is still the best option for me at this age. That question takes you off the pilot. Automatic, because the most dangerous thing in health after 60 is not having a illness, is living with a system. Messy, bad sleep due to a sedative. Raise pressure with an anti-inflammatory. Be confused by a combination. For another, and no one connecting dots. I repeat it for the third time with affection. No. Stop medications without supervision. There are drugs that should be reduced gradually. Others protect organs, others adjust according to your story. The information without guide can be dangerous. After the 60, your health is defended with two things: clarity and consistency. Clarity to know what you take and why. Consistency to sustain habits that symptoms decrease without depending on tablets. Sleep better, move a little every day. Eat with less salt and less ultra-processed, hydrate and maintain muscle. Those pillars lower need medication in many cases. And one last thing before closing, if you are thinking, I take one of these and it doesn't bother me. Nothing happens. It may be true today. Point is that risk is not always note until it accumulates. That's why the surveillance matters. Controlled pressure, kidney checked, sleep observed, careful balance. When we talk about anti-inflammatories, think about pressure and kidney. When we talk about sedatives, think about falls and nocturnal breathing. When we talk about amitriptyline and the like, think about dizziness and confusion. When we talk about antihistamines, ancient, think brain and bladder. And when we talk about lowering pressure quickly, think stability. If you want me to make a next video, tell me in one word what is the most common in your house: pain, sleep, anxiety, allergy, or pressure. And if this content helps you protect your family, subscribe. Here the objective is simple, that you arrive at 70, 80 and more with a clear head, firm steps and a stable heart. This video helped you, share it with someone you love. Many families live in the trap of, I'm taking this because I have always taken it, and after 60, it is always no longer a guarantee. Subscribe yes. You want more medical content. Clear and protective practice for seniors. Out of 60. Here we talk about prevention, intelligent and quality of life, without exaggerations, without false promises. And now tell me something, is there any in your house? Lifelong pill that no one has reviewed in years? That detail, although seems small, it could be the difference between tranquility and a scare. I am the Dr. Javier Serrano. Take care of your heart, take care of your balance, take care of your mind, and, above all, take care of your first aid kit as you do your house, because what comes into your body also builds your future.